शिवम कुछ प्रॉब्लम लग रही है क्या?
I think so. Dr. Surinder, you have, sir, if you have any problem, you can send me the presentation. I'll share the screen for you. Can you hear us? Till then, we can have another presentation. I'll just, 1 second.
Hello, hello.
Yeah.
Hello. Can you hear me? Good morning.
Yeah, we can hear you.
Yeah, good morning, sir. Good morning, sir.
Yeah.
Good morning.
Good morning.
Hello, sir. Can you see my slides, sir?
No, we can't see the slides because your screen sharing is not working, it seems. Yeah, now we can see the screen. You have to play the slides.
Yeah.
Yeah, I can see the slide number 1 now.
Good morning, sir. Good morning, sir.
Good morning. Please go ahead.
Yes, sir. Sir, brief. Myself, Dr. Surinder Singh Bawa. I'm working as a hospital administrator in Dr. Yashwant Singh Parmar Government Medical College and Hospital, Nahan, in the district Sirmaur. It's one of the interior districts of Himachal Pradesh. And this district hospital, a brief background of the situation here, the district hospital, which was upgraded to Government Medical College in 2016 with 100 students intake. So presently, this district, which is a vast hilly area and it has very interior areas, is the only tertiary care level institute which is working here. And we are having the 3rd year final MBBS batch, which has passed out, and we are entering the 4th year. So seeing the so, sir, and so regarding what we have done, the work done here, it was something, right? I wanted to share my issues and challenges and solutions in disaster management in COVID-19 pandemic situation. So, the COVID-19 issues, and so what are the possible challenges and what are the possible solutions? Being in such a difficult geographical location, and what were the things which we came to know about it, and what the difference it has made for us, and how difference can be done in all the other hospitals. Being a doctor, I have done my hospital administration from PGIME Chandigarh, and I have worked in many other departments also. It has been one of the most difficult times which we have gone under through. So what were when the COVID-19 came here, we were almost segregated from whole of the India. But as the lockdown was there, we'd have not even a single case in whole of a district. This district caters to around more than 2 lakh population. And in the Nahan town, which we are having this medical college, is more than 1 lakh population is there. There was not even a single case. So how the things came up and what we done, I think it would be a better example for all the medical colleges to follow through. So the issues was when we stuck with this thing, we had the biological disaster plan. We all had the internal and external disaster plan, but the biological disaster plan of a situation that was totally unknown was formulated, and all the resource mobilization was done at the earliest. The district administration and all the concerned departments, we had an emergency meeting, all series of meetings were there, and we had all the concerned lineup that who has the role to play in all the management regarding from this medical college to all the periphery of the hospitals. The internal and external disaster plan regarding with the biological assessment of the hospital, as well as for district civil hospitals and the subdivisional hospitals and the primary health centers were also done. Then we formulated the rapid response team and the infection control teams. It was a situation which we have never come forward. It was something that we had never met before. Then there was very little knowledge, and there were very much apprehension among the people here and the staff which was working here. So the rapid response teams were at the district level was formed by the district magistrate, and in the college also it was formed by us, taking all the important casual faculty members who were on board, and the infection control team comprising of the microbiology, pathology, and the this one histopathology, and also other trained staff. Then we deployed the key and experienced staff for duties which will have to be assigned for the hospital setup. It was something very different, and the hospital was facing, because we were open to all sort of infections and all sort of people to the who were coming to this area. I just want to give a feedback background. Just as Batti and Nalagarh district, Batti and Nalagarh area in Himachal Pradesh are having their own industry, this district of Sirmaur, where we are having this, there are two places, that is Paonta Sahib and Kalam. They are having huge industrial outputs. There is huge migrant population is here. So, and when the lockdown was open, these population had gone back, they had come back for work because there was no work elsewhere. So we had an influx of people who had gone to the positive area and had come back to this place. So we were dealing with something which was coming from all aspects. We didn't have any much feedback, and we didn't have that much of resources, as we know that Himachal Pradesh has very less resources. So training of the complete staff for handling the unknown situation was taken at the earliest. We did as much as possible orientation with the staff and training so that they can come to know about what is going to happen and what we are being acclimatized for the situation. So that brought us to the drafting of the institutional SOPs and revision of the SOPs. All the standard operating procedures which we are having in the medical college, which I can share with you later on, we have got it guidelines from the ICMR and the State Department, but we formulated our own all over in the medical colleges wherever the staff is working there. And one of the biggest challenges was the arrangement of material, funds, biomedical waste management, and vehicles. As we know, Government of India had already planned this. Was as there was lockdown, we had to have those resources well managed for 2 to 3 months, as we knew that no vendor would have supplied us things which are having shortage, and we will not be able to arrange it in such a few. So we had made this provision earlier also in a tenders and also in departments, that whenever we have to have supply of medicine, we kept a provision that in time of disasters, we will have this arrangement with all the vendors. So this helped us a lot. So building up the COVID facility in the present hospital complex, there was something which I think everybody in India must have faced on. There were positive people coming, there were people who were having contacts. So we had to make this hospital into such a both COVID and non-COVID variety that we can have those positive people also who have to have treatments, and also to have those people who are having the sampling and then make them arrangement for going back to their home. So there were many much hazards in the hospital complex which we have to take care of. And so it was all the security staff, the signage system, the wayfinding, arrangement of the duty rosters that we had done. So whatever the people who were senior in positions and who had done the duties before of different type of disasters, we arranged the duty roster like that. And there was also rosters for quarantining the staff who had taken care of the positive people. So we know that when the people look for the positive people, we are quarantining them for 10 days. Then again, they get the sampling done. Then they come after 5 days, and then they join the duties. The roster goes on. Then the most important thing was arrangement of post-mortem facility, because as we had very much of migrant population and other people coming from other places, the post-mortem facilities, as guideline changed by them, first of all, we had to have the post-mortems. So arrangement of the mortuary, having a second mortuary, inbuilt the mortuary to take the COVID patients, and having the normal post-mortem was the biggest challenge we had to face. Then referral transport and oxygen supply. What was one of the biggest problems, that we have to have the oxygen cylinders well in time to maintain the patients. The SPO2 has not to be fault. So the tie-up with the agency for oxygen supply was maintained at all the cost. We had an MOU signed with them at the earliest. So again, the demarcation of quarantine facility of our own staff. There are people, government had made the provision that isolation or quarantine patients to be kept at hotels, to be kept at dharamshalas. But what about the staff which was getting what's infected from a hospital? So we had to arrange the facility as per the provisions of the faculty, the doctors, the highly paid staff for their facility. And next, the most important was the media and handling of the information of COVID. We had to keep a hierarchy of chain of activities so that nothing wrong information goes to the public. The challenges which we met, I just want to impress that being a hospital administrator, being a trained hospital administrator from one of the best institutes in India, that is PGIMH Chandigarh, and also having the background, I think this was the time that all the hospital administrators all over the country and also in the world had to take the leadership and maintain the hierarchy in the hospital. I myself just want to tell that we are the type of over India, and we had a site, some few people who are coming to Himachal Pradesh also, and few of them were also in Paonta Sahib of our district. I was the first person in my district to take the sampling of those people because there was utmost fear and utmost apprehension of the faculty who was involved in sampling. Myself gave the decision that I will go forward for taking the sampling, although knowing that they were positive. So it was the leadership and the you can say the motivation of all the staff which has to be taken forward. So this was done, and the biggest challenge was geographical difficulty, which made us a very difficult situation. Was they had amidst a huge rainfall, there were landslides, there were very much of difficult circumstances, but we maintained the morale of the staff in all countries. And as I told you before, adequate range of material, logistic, the PP kit, N95, face shields, nitrile gloves, sanitizers, hand wash and sodium hypochlorite solution, body bags, pulse oximeter, oxygen concentrators. We had made those provisions that we could keep them going for at least 2 to 3 months. And later on, as per the government supply came, and as we had the vendors provision there, we maintained this. There was no shortage of this. And until now, we don't have the shortage of this thing. And next was the disinfection of hospital and wards and shifting of the positive patients. Those people who came positive in this patient, we had to make an isolated ward within a hospital complex. So at present, we had 250 beds. We conglomerated the hospital from 250 bed to 100 bed, and we intermingled the wards except participation of males and female patients. We had to make the positive isolation wards where we had to keep the cesarean section patients, the patients from other faculties, the trauma patients who had tested positive, and as was the roster of the staff. So we were dealing, our whole hospital was buoyed by something which you can say that the positive people living in one complex, and we had the normal function going on side by side, but we did let the morale of the patients who are coming to us that we will not be. And given these challenges, then the continuation of the operation theater and emergency, we had to make the 4 operation theaters into converting to 2 operation theaters, one for COVID facility and one for non-COVID facility. The whole of the operation theaters, because you can see there were a lot of trauma patients in Himachal Pradesh, and because of the traveling and because of the other difficulties, the operation theaters cannot be closed down. Pregnant ladies who had the deliveries timeline, they were getting positive, and they had to also come for this operating procedure despite having COVID facility, the other COVID facility in the state. But still, we didn't turn them back. We did the COVID facility operating procedures here of the positive people, our gynecological staff, our anesthesia staff was there around the clock, and we did them, and we operated that and kept at different places. Our staff was quarantined accordingly, and we had the services of the quarantine staff accordingly after the roster procedures. Coordination with the chief medical officer and principal office, for all communication and patient shifting was done and maintained with all the data and record keeping. The rapid response team, infection control team was meeting 24/7, even if it was 1 p.m. in the night or 12 p.m. in the morning, it was either 4 a.m. in the morning. We met as per the call that there is a patient there who has turned positive. We have to send him. There is a serious patient. We have to refer him. We met there as and when we required. This was one of the biggest leadership values which are shown here. Then the intersectoral coordination within the faculty, because we can say that because the medical college is a matrix of hierarchy and organizational setup. The faculty works in a different way, the organization works in a different way, than the administration works in a very different way. But the hospital leadership and the hospital administration staff work with the principal office in coordination with all the faculties, so that treatment to the patient was maintained and never denied, and was done in best interest and with all the safety provisions. Then COVID lab facility. We have the COVID lab facility developed as per the instruction of the government of India. I am very happy to share you that we developed the complete COVID lab facility, including the infrastructure equipment, within 15 days of sanction of the funds. And it was only possible because of the never dying attitude, and it was completely built as per the safety guidelines, as per the guidelines of ICMR, the flooring, the tiling, the epoxy floorings, and all with ventilation, the sample collection area, the storage area, the sample collection booth. Every SOP was kept in the mind, and we developed the COVID lab facility for the district within 15 days. And now we can say that from the March onwards, we never had to send the patients samples for outside to Kasoli or to PGML for testing. We are doing round the clock COVID testings in a hospital only, and we are reporting. I'm very happy to share to you that we are reporting within the same day. You can say labs in Chandigarh or Delhi, they're reporting, we have seen the television 3rd or 4th. We are reporting the data is given same day, and it goes to the chief medical officer and the district administration the same day, and the patient is dealt accordingly. The deployment of the trained registration counter because we didn't stop the OPD. So there we developed an app, and we developed the provision of and form generation and the COVID app stamp. That there was a person who was mentioning this registration counter. He was stamping the slips as accordingly all the ILI patients or URC patients to send them to the URC facility that was established in the COVID lab. So it was there, and we have segregated the patients then and there. And again, there was no electrical back down in the COVID lab. We had 24/7 international facility there. Quarantine facility was there in the COVID lab. We kept the OPD management as with 1:1 patient in one OPD, and separation of the patient there and there from again taking into the labs where the sampling was done, separating the patient from the labs to the test reporting areas, and separating the patients from there to the outside of the area, hospital. So we had one entry and exit point in all the areas of the hospital with proper signage and with electrical which I am telling you that as we can see that
Dr. Surinder, you have 2 minutes left.
Yeah, of course. Thank you.
Please conclude.
Thank you.
Thank you.
I just want to share, if you have the trained hospital administration, that makes the difference in running the hospitals. It is the decision making, it is the positive attitude and involvement of all the persons, right from bottom to the top. I will not say the top to the bottom to the top. Every person playing the role, having the safety of the patients in care. You have all the solutions with you, all the required things with you. But the difference is that leading the people, making the things to happen in the hospital with all those civil and legal and disaster acts in view, it's one of the, just like I was telling you that when there was lockdown, the kitchen facility, we had kept the management of the kitchen facility, and we invited the local NGOs and the trust, the Rotary, so that we could have the material logistic for running the kitchens for the staff there. The staff was apprised of all the facilities, what happened to. We managed the kitchens accordingly. We managed the store, which was very one of the different. We had the gowns, the aprons, that all the consumables with us. We did a perfect networking. We met the whole of the district administration and all the people around us, and we took the services of all the neighboring states also, like PGI Chandigarh. Then we had the Haryana is there. Then we had neighbor Jammu and Kashmir. We take the services, the knowledge, the name, how do they perform that, and we incorporated those in the SOPs. So we maintain these things and all the other things which are required. So decentralization, monitoring mechanisms, CCTV coverage, segregation of the OPDs, all these things we have done this with the role of the hospital administration. I just want to say that we had a very difficult time. We still are having a very difficult time. People are getting positive day by day. The younger generation is getting positive day by day. Although there is a cure rate, but coming to the hospital, making the hospital function despite so much of odds was one of the challenges which we faced, and we are still facing now. And I think the hospital administration has taken one of the biggest roles in running this hospital. And I can say that till date, only 2 of our doctors and 3 staff nurses have been in quarantine due to contact with one of the positive patients working there, but no one has come positive till date. I'm very happy to share with that. Thank you very much, sir. Thank you.
Thank you, Dr. Saab. Very nice presentation. Congratulations for your hard work. I would just like to know which testing method you are using, which gives the results on the same day. Is it the RT-PCR or some other method?
Sir, we have the TrueNut facility also, where the report is there for screening. It comes within 3 hours, and the RT-PCR reporting is done after that also, and we give the report by 6 or 7 in the evening every day.
Okay.
Of the RT-PCR. Even if we have taken the samples in late, it takes 6 to 7 hours. It takes 6 to 7 hours. Even if the samples are taken after 4 p.m. in emergency, we give the report before 12 o'clock in the night.
And how many total COVID patients you have dealt in your hospital so far?
I think beginning. So far we have come right from beginning. We have dealt with more than something. It's something more than 800 plus. I don't have the figures, but every day I see the report. It's
roughly it is 800 or so. Very
800.
great.
800.
Very great job.
And,
Congratulations.
And sir, I'm very happy to tell you that following all the procedures, we are running the hospital day and night. Our staff is motivated, but we have maintained the infection rate. I just want to impress you. We maintain the infection rate less than 1%. So we are not infected as staff, because the staff is so valuable. We have to keep the hospital running.
Yes, and your medical college training and classes are going on as usual, or
No, sir.
Are
No,
they
sir.
in
The online
digital-
classes are going on. The online classes are going on.
online class?
Online classes are going on. As suggested by government.
Let me request Mr. Shukla if he has any question.
Yeah, good. Thank you very much for the presentation. And I'm just trying to figure out. You have mentioned that this hospital administration is trained, then they are able to manage better and give leadership. So what kind of training are you talking about? Are you using an HMIS?
Sir, we are already using HMS. What I want to emphasize is on that in India we are having private and regular medical colleges. The concept of having the medical superintendent in the hospital who has to have the degree of hospital MD in hospital administration or masters in hospital administrations with the background of administration makes the difference. Coming from a hierarchy of a medical officer who by the virtue of his seniority becomes the medical superintendent college today as it is required. It is a trained hospital administrator. जैसे आपको एम्स का MS है, PGI का MS है, और भी autonomous institution का MS है. They have that background and they have that knowledge. Roughly, we are having more than 600 laws that are involved in hospital administration. No regular medical officer will having the idea of what are the laws involved in medical professions. And roughly 200 laws are coming in force in everyday practice of this. Myself being in this profession, I can understand if somebody calls me, this is the situation there, right in the 12 o'clock, I know how to give the solution. So that is the issue.
Your background is, you are an administrator, hospital administrator, or?
Yeah, I have done my MBBS, sir. I have done my post-graduation hospital and diploma in hospital and health management. Then again, I have done my master's in hospital administration in PGI. I'm a doctor by profession.
Okay. So, I mean, I can figure out, I can understand that this kind of training is important, and that is how you've been able to contain the infection rate and keep the services running.
Right, sir.
And it's good to know that this kind of what is the size of this hospital?
Sir, we are having almost it's a very old hospital. We are having almost more than 2 kilometers area. This hospital is spreading more than 2 kilometers area, and the actual hospital building is having around, is more than, you can say, spread out in 1 kilometer radius. We are having more than 500 beds here of different specialities. So at present only we are running 100 beds because of the COVID facilities. We can't manage all the beds, but we are not stopping treatment to anybody who is required. Even the hemophilia patients or even the routine patients, we are managing them. Even
and you have also managed to contain the cross infection.
Yes, sir.
Among the patients.
Yes, sir. Yes, sir. We are immediately identifying the patients who are coming to the OPD. We are segregating them, and we are again redistributing them. We are having the waiting area period maintained like that. We are having the reception area maintained like, and so that is the reason why our doctors are also not infected till date. Besides having contact to contact, अगर एक patient को देखना है, फिर भी स्टेथो लगाना तो पड़ेगा, BP तो देखना पड़ेगा, लेकिन हमारे डॉक्टर्स अभी तक इन्फेक्ट नहीं हुए. SOPs ऐसे रखे हैं हमने कि उसकी कंटेनमेंट जोन्स ऐसे बनाए हैं. We are having the grilled sodium hypochlorite solution every morning and evening. Everything is maintained as per SOPs, despite being a smaller state and having so much less resources. But we are doing our best here, sir. I am proud to say that.
Thank you.
Thank you, sir.
Thank you, Dr. Surinder. So we'll have the next presentation from Mr. Sai Ritwik, Management Trainee for the project COVID-19 Hospital Management from Department of Health and Family Welfare, Andhra Pradesh. He may present. Thank you so much.
I'm sorry, Ritwik isn't here, and I'm Dr. Sama. Am I audible?
Yeah, you are audible.
Yeah, I'm Dr. Sama. I'll be presenting in place of Ritwik, and I'm the management consultant for Department of Health, Medical and Family Welfare, Government of Andhra Pradesh.
Dr. Sama, you are visible, but you are not visible.
I'm sorry. Just a second. Yeah. So I'll share my screen now.